And welcome back. Vertebral compression fracture is a fracture that affects about 750,000 Americans every year with an injury. The injury leading to debilitating pain, not only pain, but also it leads to limited activity and also a downward spiral of poor health, including pneumonia, digestive troubles, and even blood clots. The question is, what kind of treatments are available? What kind of help is available? And how do you diagnose vertebral compression fracture? Well, here to share a little bit more with us is the department chair of Jacobi Medical Center of Radiology, Dr. Orlando Ortiz. And Dr. Ortiz, good to have you here. And when we talk about vertebral compression fracture, one of the things that people have to worry about is osteoporosis. And that's a big challenge too.
So osteoporosis affects the bones of the body. It makes them more brittle, and hence simple stresses or emotions like a cough or a sneeze can cause a vertebral compression fracture and result in significant pain and debilitation.
And when we talk about a vertebral compression fracture, how do you define that to the average person? How does that usually occur?
Okay, well, the spine is made up of building blocks or bony blocks stacked on each other. And we can kind of think of each of these blocks as almost like a brick, if you will, but it's round. And if the bones get weakened and a compression fracture occurs, the bone collapses upon itself at one level. And when that collapse occurs, it results in severe pain, in deformity and kyphosis or angulation of the back. The fracture itself is causing pain because it's unstable. It's as if when you have a fracture in your forearm or your leg and a cast is not on it yet and you try to move, it hurts. The same thing is occurring in the back. The areas in the back that are particularly predisposed is a concern for vertebral compression fracture, however. The management strategies are as follows. First, there's conservative management with bed rest, pain medications, medications for spasm, and perhaps back bracing. This may be tried, and some people do respond to that, and if it helps you get better and feel better, that's fine. But then there are times when the pain is so severe and you're not getting better despite these conservative measures, where you may need to consider.
Don't mean to cut you off, but I want to get to the part about balloon treatment, because I do know that there's a balloon treatment that's available. And so what exactly is the balloon treatment?
And the goal of that balloon is when it's inflated temporarily, it helps to reduce the fracture, restore height, and restore alignment. The balloon essentially creates a space also inside the bone. The balloon is taken out, and then another type of device is placed in where we're able to inject an acrylic medical grade bone cement into the space created by the balloon to stabilize the fracture. So what this procedure effectively does is it creates an internal cast within the bone, and that's how it provides pain relief and stabilization. So instead of having a cast put around your extremity where it provides pain relief and helps the bones to heal, we put the cast inside the bone to essentially achieve the same result. And now, this is a procedure that can be performed either in an outpatient setting or an inpatient setting. It's performed as an operative procedure. It's an operation, and it does entail some mild risk, but it has a significant benefit being, again, relief of the pain, stabilization of the spine, and also, once you do that, you reduce the chances of getting another fracture.
Yeah. I was getting ready to cut in because I was getting ready to ask the question, but you answered it for me about inpatient or outpatient, right? Because that seems like something that's very, very intense, but yet and still you can have it done on an outpatient basis.
Yes, for example, we perform the procedure here at Jacobi. Patient will come in the morning. We obviously see a patient first beforehand in consultation. We examine them, we talk with them, and determine whether or not they might be a candidate for this procedure. And to be a candidate, you have to have A, a fracture, and B, pain related to that fracture. And after we discuss the benefits and risk and provide information about the procedure, and the patient decides to have it, they come in the morning and we prepare them for the procedure, which we do under fluoroscopic imaging. We're able to use x-rays to see the bones and to see exactly where we're putting our devices. We do this as an operative procedure. It takes an hour or two, maybe, depending on what we're doing for that particular patient. And then after the procedure, they're recovered in our department for a few hours afterwards, and they go home that same day.
Great news to know, and obviously for people who are affected. So listen, let me ask this before I get out of here. What are some of the signs and the warning signs that people need to be paying attention to before we go? So that way, if somebody's saying, hey, I may be affected by this, what should they know?
Number one, that back pain, even though it's common, we all get back pain. We have days of back pain, but we have to separate this vertebral compression fracture back pain from our typical pains. This is something different. This is a pain that doesn't get better with bed rest. You wake up in the morning and it starts again. The minute you start to move, it lets you know that the fracture is there, because the pain can be fairly significant and debilitating. So if you're having back pain that's not responding to the usual things that you do to treat your back pain, whether it's putting an ice pack, a warm pack, laying down, or taking some Tylenol or ibuprofen, if the pain is getting worse and it's in your back and it gets exacerbated by any motion that you do, any usual standing up, moving, walking, then you know something serious may be going on, and you need to see your doctor to get evaluated further to determine whether or not you indeed have a vertebral compression fracture.
Well, Dr. Ortiz, we're going to leave it there. Thank you so much for sharing with us, enlightening our viewers exactly on vertebral compression fractures, something that some of us may not be familiar with, but what we said at the beginning of the show affects 750,000 Americans annually. Thank you so much, Dr. Ortiz.
You're welcome, and thank you very much for having me. Have a good day.
All righty. Good to have you.
Bye-bye.
Listen. Bye-bye. All righty. Well, listen, we want you to stay with us. We do have more show. We're coming up right after this.